The medical tent smelled of antiseptic and clean linen. That alone confused her. She had expected dirt, cold, the smell of a place that had stopped caring about such things. Instead, there were labeled cabinets, sterilized instruments, basins of clean water. An American doctor with gray hair and round spectacles looked up from his clipboard as she entered. He said her name. She didn't answer. He gestured toward a chair. She didn't sit. He asked his first question. She answered in a flat voice, the voice of someone who has decided to give as little as possible to a situation they don't trust. Then he asked her to show him her hands. She held them out. A reflex. 6 years of being a nurse had made showing her hands automatic. He took them in both of his and turned them over slowly. He didn't speak. The medic beside him didn't speak. The only sound in the tent was the rain starting outside and the distant movement of the camp beyond the canvas walls. The doctor looked at her hands for a long time, longer than made sense for a routine exam. Then he set his clipboard down on the table beside him. He turned to the medic. He said quietly, "Everyone out." The medic looked at him. He said it again, "Everyone out." Now, the medic left. The other staff left. The tent flap fell closed. And for the first time since her capture, she was alone with an enemy doctor who had just cleared the room after looking at her hands, and she had no idea what was coming next. Her name was not important to the camp records. She was a number on a transfer document, a German field nurse captured in the final weeks of the collapse, processed through 2 collection points before arriving here, 28 years old. 6 years of nursing, the last 2 in forward medical stations that moved every few weeks and ran out of everything except patients. She had arrived that morning with 11 others, transferred from a facility 40 kilometers east. The journey had taken 2 days. She had not slept. She had not eaten since the morning before. She had spent the transit working out, with the methodical precision of a trained medical mind, exactly what to expect and how to survive it. The medical exam had not been on her list of things to survive. It had seemed administrative, routine, the kind of thing you got through by giving correct answers and showing nothing. She had not accounted for the doctor noticing her hands. His name was Collins, Major, Army Medical Corps, assigned to the camp for 3 months. He was 51 years old and had been a physician for 25 years before the war, a general practitioner in a small city in Ohio who had delivered babies and set broken bones and sat with dying patients through the night. He had a particular quality, the inability to look at a person without actually seeing them, that had made him a good doctor and an occasionally inconvenient colleague. He had seen hands like hers before, not often, but he knew what they meant. When the tent was empty, he pulled a stool close to her chair and sat down, not behind the desk, beside her, at the same level. He said, "How long have you been working through this?" She said. "Through what?" He looked at her hands again, the thickened skin at the base of each finger. The old blisters healed over and reopened and healed again, the particular roughness of someone who had washed their hands 100 times a day for months with whatever soap was available. And underneath all of that, something else, a tremor she had been controlling so well it was almost invisible. Almost. He said, "The fever. How long?" She went still. He said, "I'm not asking to report it. I'm asking because I need to know how long it's been untreated." She looked at him. He looked back. His expression was the expression of someone who has already decided what to do and is waiting for the information he needs to do it correctly. She said, 2 weeks. Maybe 3. He nodded. He picked up his stethoscope. He said, "I'm going to listen to your lungs. Tell me if anything hurts." She said, "I'm a prisoner. I'm here for processing, not treatment." He said, "You're here because you're in my tent, and in my tent you're a patient." She didn't respond. He placed the stethoscope against her back and said, "Breathe in slowly." She breathed in slowly. He listened. He moved the instrument. He listened again. His face did not change, which was itself a kind of information, the controlled expression of someone hearing something they expected and do not want to alarm the patient with. He called the medic back in and said something in a low voice. The medic left and returned with equipment. Collins worked through the examination with the focused efficiency of someone who has done this 10,000 times and is not doing it for show. He checked her temperature. He checked her blood pressure. He looked at her eyes, her throat, the lymph nodes at her neck. When he was done, he sat back and looked at his notes. She said, "What is it?" He said, "Your lungs are infected. Seriously. You've been working through a fever that would have put most people in a bed weeks ago. If this had gone another week without treatment, you would have collapsed, possibly worse." She looked at him. He said, "You knew something was wrong," she said. "I knew," he said. "And you kept working," she said. "There was work to do." He looked at her for a moment. The particular recognition of one medical professional for another. The specific understanding of someone who has also, at some point, chosen the work over their own body and knows exactly what that costs. He said, "There isn't any more. Not today." He stood and wrote on his clipboard. Treatment, rest, monitored temperature, fluids. He noted the tent section she would be moved to. He wrote everything down with the precision of someone who understands that what gets written down gets done. Then he stopped writing and looked at her. He said, "When was the last time someone took care of you?" She didn't answer immediately. The question sat in the tent between them, too simple and too large at the same time. She said, "I don't remember." He nodded once. Then he called the medic back in and gave instructions. She was moved to a quieter section of the medical tent. A cot with a clean blanket, a basin of water, medication in a small paper cup. The medic who brought it was young, perhaps 20, and set everything down carefully, and said something in English she didn't catch, but the tone was clear, the tone of someone doing a job they take seriously. She sat on the cot and looked at the medication. She had given this same medication to patients dozens of times. She knew exactly what it was for and exactly what it would do. She took it. She lay down. The fever that had been living in her body for weeks rose that night and broke toward morning. She was aware of it happening. The heat, then the cold, then the soaked blanket, then the medic appearing with water and a dry blanket. She drifted in and out. At some point she heard rain on the canvas above her and thought, for a moment, that she was somewhere else entirely. Then she remembered where she was and lay still and let the medication work. On the third morning, she woke with a clear head for the first time in longer than she could account for. Collins came to check on her that afternoon. He listened to her lungs. His expression shifted slightly, the controlled shift of someone hearing an improvement they had been working toward. He said, "Better." She said, "Yes." He sat down on the stool beside her cot. He said, "I heard you speaking to one of the patients this morning, the boy with the leg wound." She said nothing. He said, "He was afraid. You calmed him down." She said, "I spoke German." He understood. Collins looked at his hands. Then he looked at her. He said, "I have a shortage of trained people. What you did this morning, that's not nothing." She said, "I'm a prisoner." He said, "Yes, and you're also the most experienced nurse in this tent." She looked at him. He looked back. He said, "I'm not asking you to do anything that compromises your situation. I'm asking if you're willing to help patients. Any patients. Because infection doesn't check identification papers before it kills people." She was quiet for a long moment. Then she said, "What would it involve?" He told her. Supervised work. Limited access. Her status unchanged on paper. But in the tent she would work as a nurse, because that was what she was, and because the alternative was watching people suffer from things she knew how to treat. She said, "I need to think about it." He said, "Take the time you need." He left. She lay on the cot and looked at the canvas ceiling, and thought about it for the rest of the day, and most of the night. She thought about the 6 years, the forward stations, the evacuation wards, the nights that ran into days, the patients whose names she had learned and then lost. She thought about the building that no longer existed, and the doctors who had scattered, and the wounded who had been moved or abandoned or buried beneath broken stone. She thought about the boy with the leg wound that morning, and the way he had gone still when she spoke to him in German, and the relief in his face, simple, complete, the relief of someone who had been afraid and was suddenly less afraid. She thought about Colin sitting beside her on the stool, at the same level, not behind the desk. She thought about, "In my tent, you're a patient." In the morning, when he came for rounds, she was already dressed. She was standing at the medication cabinet, reading the labels with the focused attention of someone relearning a room. She said, without turning around, "Where do you need me?" He said, "The intake section. 3 new arrivals with untreated wounds." She said, "I'll need gloves and a proper kit." He said, "Cabinet on the left. Third shelf. She opened the cabinet. She found the gloves. She put them on with the practiced movement of someone for whom this was not a new gesture but a returned one. The movement of a person picking up something they had put down and were now picking up again. She went to the intake section. She worked through the morning without speaking more than necessary. The medics around her watched at first, then stopped watching and started working alongside her, because there was too much to do for watching. At the end of the shift, she washed her hands at the basin. She looked at them in the water, the same hands he had examined, the same thickened skin, the same old marks. They were not shaking. She dried them on a clean towel and went back to her cot. That night, for the first time since before her capture, she slept without waking. Collins, writing his notes at the end of the day, wrote one line that was not part of any official form. He wrote, "She came back." He looked at it. Then he added, "As I expected." He closed the notebook. Outside, the rain had stopped. The camp was quiet. In the medical tent, the lantern burned low over the cots, and somewhere in the middle of all the things the war had broken and the things it had not quite managed to finish breaking, a nurse slept with her hands still for the first time in months.